Hi, my name is Abby. Welcome to the Get Smart with Your Pharma, episode 3. This one is called Pain Pharma, the swampiest of all. Pain relief is an essential part of healthcare, and I am fed up with government turning it into a bureaucratic swamp. I'm just going to be blunt and put it right out there. I've been a nurse long enough to see pain control go from a routine part of healthcare to the big pressure to give more opioids during the 90s and then the backlash following that. And I'm really, really tired of government intruding into healthcare, often in the name of law enforcement. It's definitely overreach and it harms people. Um, I want to talk about just three bureaucracies involved with this today: the CDC, the DEA, and Michigan MAPS. I'll take it in reverse order. The Michigan Automated Prescription System, or MAPS, that became mandated, and it's housed under LARA, the Licensing and Regulatory Administration of Lansing. Their Bureau of Professional Licensure requires registration, login, and documentation of all controlled substances that are prescribed in Michigan. Some would like to further that mandate to require all prescriptions to be entered into the state MAPS database. You can make what you like of that. I think that that's excessive. It's already known to the physician or the prescriber and to the patient and to the pharmacist. And I think those are the only people that actually need to know what's being prescribed when and how much and to whom. The second bureaucracy is the CDC. According to the Doctor Patient Forum, it is estimated that more than 1 million people with chronic, intractable pain lost access to their pain care shortly after the CDC published opioid prescribing guidelines in 2016. It led to patient abandonment, untreated pain crises, medication shortages, and that's not the end of it. The Congress right now is dealing with another bill um, to further um, legislate and regulate controlled substances. The other recent item in the news is that Trump appointed Mr. Maltz, who is a big fan of the war on drugs, to be the head of DEA, which is the third bureaucracy we're dealing with in this space. Um, I have no problem if, I mean, the war on drugs is a separate conversation, I should say. Um, if they want to stop drugs at the border, if they want to stop drugs on the street, if they want to stop illegal trafficking of drugs, that is a separate question from healthcare prescribing and taking of controlled substances. And I think that should remain a completely separate conversation. Um, Instead of the constant drive, it's much easier to regulate healthcare people than it is to regulate illegal drug dealers. I don't know if you've noticed that, but legislators are big fans, in my book, of doing this regulation of healthcare and making it sound like they're tough on drugs. And I'm fed up. They have no place in healthcare. That brings us to the DEA. Many providers have stopped treating pain due to DEA regulations, fear of state medical board sanctions, and government retribution. That is a quote also from the physician, the Doctor Patient Forum, which is active in this space as well. They've done a lot of research and they gather people together to share their stories and find out what the real facts are. You may or may not know anyone with chronic pain. I suspect that you do, and you should ask them if they've had trouble getting pain medications in the last 10 years, if they've had to restrict how much they actually need to control their pain, or if they've had trouble even finding a doctor to prescribe for them. Michigan had a major provider of clinical pain control go under. They went bankrupt in 2024. 6 clinics closed in the Grand Rapids area. And the word from the people themselves was that it was that insurance refused to reimburse them for their costs. And so they went bankrupt. That's another bureaucracy that I don't have the deep background on, but I would love to know. If you do have any information on that, please contact me. So about the DEA, the DEA requires, it's a federal license that everyone who is going to prescribe controlled substance has to get this license. The application alone can range from $731 to $3,007. Not sure if that's the postage or what that extra little bit is on the end there, but that's a lot of money. And for anyone when is starting up a medical office or maintaining a license, it's reportedly a little bit less to renew this license. But it's a federal bureaucracy, and so you don't always get the best service either. Um, I believe that it's simply outside the constitutional role of federal government to be dealing with local pain control in this intrusive manner. It's also interesting to look at the actual DEA mandate according to their own stated purpose. I'm just going to show that screen here a minute. The DEA enforces the provisions of the Controlled Substance and Chemical Diversion and Trafficking Laws and Regulations of the United States and operates on a worldwide basis. It presents cases to the criminal and civil justice systems of the United States or any other competent jurisdiction on those significant organizations and their members involved in cultivation, production, smuggling, distribution, laundering of proceeds, or diversion of controlled substances appearing in or destined for illegal traffic in the United States. DEA disrupts and dismantles these organizations by arresting their members, confiscating their drugs, and seizing their assets, and creates, manages, and supports enforcement-related programs domestically and internationally aimed at reducing the availability of and demand for illicit controlled substances. That, to me, does not sound like anything like my local doctor's office. I don't know about yours, but I think it would be a great project in draining the swamp for the Trump administration to get the DEA out of licensing our legitimate clinicians and prescribers. So that's what I have to share today. I can add a little bit about my own experience breaking my wrists last month. I am doing well with therapy, getting my splints and having much better pain control. But I think it's important to note in this swampy space, we're talking mostly about chronic pain control. My acute short-term surgical and injury-related pain has been pretty well controlled. I had fentanyl in the ambulance by IV, and I did notice that they were only allowed to give it by IV. They could not give me an injection until they had an IV started. In the emergency room, I was given Tylenol and fentanyl, and I was sent home with Norco, all fairly appropriate. In the surgery, I had general anesthesia. If it was just one wrist, it would have been a block. But as it was, I woke up in horrible pain. And in the recovery room, they literally gave and wasted the same medication every 5 minutes for me. And I still wonder, why didn't they just hang on to it? I am confident that that wastage that they had to document and have a witness to is related to federal regulations. So that is also raising our healthcare costs. When you're forced to waste a drug when you know in 5 minutes you're going to have to give more of it. And so I just thought those are interesting observations, but just be aware it's usually not your short-term surgery or injury-related pain that is being impaired by these hyper regulations to a degree, but the worst part is for those with chronic pain, whether it's from injuries or disease or whatever the cause may be. So thanks for listening. And if you get a chance to talk to your congressman, or to anyone in the Trump administration, encourage them to drain this particular bureaucratic swamp. And thanks for watching.